All right, welcome everyone. We're going to get started. Welcome to the final virtual session of our summer series for families during COVID-19. This session will focus on planning for the start of the school year during COVID-19, and we will have 3 experts in the field of special education to provide you with information about compensatory education, reminders about laws, procedural safeguards, how to prepare for school and opening up communication, documentation tips, meaningful planning, and a lot more. My name is Amy Clausen, and I'm the Northern Ohio Family Specialist at Ohio Family to Family. We are housed at the University of Cincinnati Center for Excellence in Developmental Disabilities that sits within Cincinnati Children's Hospital Medical Center. And my colleague, Celia Schlomer, is our Family Support Coordinator at the UCED. Together, we will be facilitating our panel discussion today, and we will be monitoring questions in the chat box. And of course, we'll have Q&A at the end of the discussion. We're very fortunate to have 3 amazing speakers today. John Price is an attorney from Disability Rights Ohio. Yvette Sarkar is a specialist with Ohio Coalition for the Education of Children with Disabilities. And Vicki Coleman is a parent mentor at Northwest School District near Cincinnati. First, Celia and I would like to thank all of you for joining us. We know how challenging these unusual times are, and we are hearing about the immense stress families are having about handling the return to school. Please remember that we are in a national emergency. Sometimes I need to remind myself that as well. But most importantly for today, please know that sometimes we may not have good answers for you. Not all the education questions can be answered today, but we will focus on what we do know and how you can be more supported. So let's address a few logistical details. Your audio lines are muted throughout the entire presentation. You can submit your questions during any time on the chat box on your screen, and you can send a question or comment in that chat box to the whole audience or privately to one of the presenters or the staff. We'll combine some questions. We may not be able to answer all the questions, but we will have discussion and address most questions at the end during the Q&A. This session, again, is being recorded and will be uploaded onto Ohio Family to Family's website at ohiof2f.org. Lastly, we'll have an evaluation at the end of the training. Please give us your feedback on today's webinar as well as other future topics you would like us to address. And with that, we welcome you again, and I will turn it over to John Price. Thank you.
Well, thank you, Amy. Thank you for having me back. I hope most of you all on this call were able to participate the last time I spoke on compensatory education, and hopefully you found it useful enough to come back. Next slide, please. Okay, so basically, I just wanted to give you a quick overview of what I want to cover. We have some other great presenters who are going to fill in a lot of the gaps that I don't get to. I want to keep mine kind of focused on, law and really kind of as concrete as I can. But I want to go over a little bit about the little bit that the department has told us about reopening. I want to talk about FAPE, or Free Appropriate Public Education, in the COVID era and what that means for you and your child. I'm going to discuss a little bit about IEP meetings and evaluations in the COVID-19 era, and then I'm going to touch on compensatory education and procedural safeguards as well. Next slide. So before we get started, I just want to kind of put give you a little bit of practical considerations about how you might approach the coming weeks. Unfortunately, there's still so much that remains uncertain, and Amy touched on this a little bit, but there's still so many questions that do not have answers to even, to the best of our ability to get those answers. So we don't know how long COVID is going to be here with us. We don't know how long schools will be impacted, and we don't know what steps that the Department of Education or the governor or even the federal government might take. So just understand that this information that's presented to you today can change, and it has been changing on a daily basis. And what we have here is the best information that we have available. And then also, and you'll hear me say this several times through the presentation, but to the extent that you can, try to work collaboratively with your school district to determine what's going to happen, because we know that disagreements will arise, but for the most part, people are trying to do the right thing, and lots of school districts and personnel are feeling very overwhelmed. And I think, getting a good working relationship is going to go a long way. Next slide, please. So with that in mind, that there is so much uncertainty, if you're anything like me, I'm a very type A kind of person. I do not like to have things that I don't know. I do not like uncertainty. That's why I went to law school, and that's why I do what I do. So the thing that helps me reduce my anxiety is getting the most information that I can. So you're already taking a really important step by participating in programs like these. So some other things that I would suggest that you do as time goes on is check the federal and state departments of education for updates. I've listed the websites for Ohio's coronavirus main resource page and the Ohio Department of Education. Those pages are updated when there's new information available about what those departments are doing, and I would suggest that you get in the habit of checking that fairly frequently. Of course, monitor your state and local news. Like those kinds of resources are going to give you the most up-to-date information about what's going on in your communities. You're also really going to want to check your local school district policies. And I will get into this, but the way that this has kind of shaken out is school districts have been given a lot of leeway, for better or for worse, from the department about how they're going to handle reopening. So it's going to be kind of incumbent upon you to track down that information and make sure you have the latest. And then lastly, this is probably the most important thing, just stay in communication with your district because they're going to be the ones who can give you the most up to the minute updates that may or may not be on the district website, for instance. So Ohio has, the department has started kind of implementing a program called Reset and Restart, giving school districts guides to reopening with things like, just guidelines and things that the Ohio Department of Health have recommended about social distancing. The guidance primarily contains non-mandatory guidelines. So like I said before, the department is being really careful about telling districts that they have to do certain things, which means that there are as many school districts as there are in Ohio, and I can never remember what the number is. That's how many different answers there are to certain questions. But I did want to bring this to your attention. I don't want to spend a ton of time on it, but if you want to see what the department is saying or read the Reset and Restart guidance document, I have attached a link to it here, and it's also on their website. Next slide. So FAPE during COVID-19. So this is maybe the most central question that we have in special education is, what does a free, appropriate public education look like? Like that is what we're fighting about in special education disputes, regardless of what's going on in the world, is a free, appropriate public education. And the main thing that I want you to know is, from a legal perspective, the definition of a free, appropriate public education has not changed in the COVID-19 era. So all the obligations and the high expectations and the things that are supposed to be in the IEP that existed on March the 1st or whenever the last day was before all this started, those things are still requirements. I have listed here the kind of oft-quoted phrase from the latest Supreme Court case about this, but IEPs should be reasonably calculated to enable a child to make progress appropriate in light of the child's circumstances. that is still the requirement, and that is still what school districts need to be talking about. That means they still need to have the same high expectations of students, and they're still going to be held to those standards. Next slide. So COVID guidance issued by the U.S. Department of Education way back when all of this started discusses FAPE and makes clear that FAPE is still substantively the same guarantee that it was before the pandemic. It does contain some language that recognizes that school districts may not be able to provide services in the manner that they are normally provided, but it does direct school districts to do the best they can, and if they are unable to meet all of the obligations, then it directs them to talk about how those services are going to be compensated once school is able to look more normal. Next slide, please. So the State Department of Education has also issued some guidance on FAPE, which I think has caused a little bit of concern among some parents and parent groups because it contains some language that makes us feel a little bit uncomfortable. It states that when working with students through alternative delivery models, so basically if your school district is going to an online only model, for instance, and is not providing any sort of in-person normal services, it directs districts to make a good faith effort within available capabilities to determine how a FAPE will be provided. I have kind of struggled with what I think about this language. I mean, the way that I kind of look at this is FAPE is a federal guarantee. It is rooted in federal statutes. And even if Ohio even wanted to change the definition of FAPE, they would not be able to do so. And I do not interpret this regulation to change the definition of a school district's obligation. I think it recognizes the same thing that the Federal Department of Education recognizes, is that FAPE exists out there as this level of service that we expect, but it also recognizes the on the ground reality that some students are just not going to be able to benefit from remote delivery models that they would be able to from in-person instruction. But it does not excuse school districts or let them off the hook for it. It merely makes the point that they should do the best they can to provide those services in the safest way possible. And if what they are able to do ultimately falls short of FAPE as we understand it, they should be discussing what kinds of compensatory education services are going to be given to those students once they are able to give them, meaningful in-person services that they could actually benefit from. Next slide, please. The state guidance also gives some factors about how to think about FAPE in a remote online guidance. So these are the kinds of things that IEP teams should be talking about when they're talking about how they can make FAPE available during this time if in-person instruction is not available. They need to be making sure that special education students have access to remote instruction, equal access to remote materials. So if a school district is just providing materials out there, they need to make sure that the special education families have the ability to access it. So making sure they have, if they don't have internet, for instance, they need to make sure that they are either finding some way to make internet available to that child, or making those materials available in some alternative means. The materials that they use need to have the ability to differentiate instruction. So the very core of what specially designed instruction means that it needs to be specially designed, which means it's different. So if the materials they're using are one size fits all, that's an indication that they may not be appropriate. They need to have the ability to provide the child's supports and related services. So any sorts of supports that the child needs in the classroom in order to be able to access the materials, they need to make sure that that is being made available in some way. This also may include training for staff, students, and even parents on how to use the online program. So if you as a parent are really struggling with what the district is expecting your child to do, or the mechanics of it, then the state guidance actually, does talk about parent training. So maybe that is a discussion to have with your child's IEP team. They also direct teams to have a communication protocol, so a way to, make sure that people are staying communication and documenting that communication, and making sure that they're identifying the role of instructional aids and assistive technology in the educational delivery. Next slide, please. So what does all this mean in summary? Your child is still owed FAPE as defined pre-COVID. So as I said before, that has not changed. So you and your school district need to work together to determine how to meet these needs, given whatever limitations exist. So basically, it's do the best you can. So you figure out as practically as possible how your child is going to get whatever services they need to get a meaningful education. Then it's incumbent upon the district to do the best they can to make sure that that happens. If FAPE cannot be met for whatever reason, then your child should be provided compensatory education once kind of everything calms down some. Next slide, please. So the IEP meetings are going to be critical. They're always critical. They're always the first step and the most important part of the special education process. So my recommendation to you is, if you have not done so, you get an IEP meeting scheduled as soon as possible to discuss what your child's services are going to look like this school year. The team needs to consider the format of the services your child receives and how they will be supported and kept safe. So whatever model your district has decided to utilize, whether it's everybody's coming back in the building, everybody's going to be online, or some sort of hybrid system, the IEP team needs to make a decision about what that's going to look like for your individual child. And what the team may figure out is the one size fits all paths that they have set out may not work for your child. So what works for your child may look different than what other children need. And that's the very essence of special education. So my advice is, just making sure that you're having the meetings and that you're having these conversations as early as possible so that everyone is on the same page. IEP meetings can be conducted virtually or by phone. If you have not had one yet, there is no reason that the IEP meeting has to happen in person. And in fact, I would say that the safest thing to do right now is to probably is to have them virtually or by phone. And another thing that we've kind of all talked about is you may want to talk about getting more frequent progress reporting, since things are so in flux. Every 9 weeks or 10 weeks progress reporting may not be frequent enough for you to make kind of real-time decisions about like for instance, if you decide that your child is going to follow an online only model, you want to know that that's not working and something needs to change before October. So that's just something you might want to think about. Next slide, please. So instructional format decisions, I kind of, this was one of the last slides that I added just because it's something that I've been hearing about. I've seen on the news and I've heard some anecdotal evidence about lots of districts saying to parents, we're going to have a kind of bifurcated model of instruction. So, you have the choice to either send your child into school for, 5 days or 4 days or 2 days or whatever, or follow an online only model. And they are actually giving parents deadlines, like we need to know by X time, whether your child is going to follow a certain path, which will last like throughout the end of the semester or the end, in some cases, even the end of the school year. What I want you to know about that is IEP team decisions trump any deadlines set by the school. So if your school has told you that you have until X date to decide how your child is going to be instructed for the school year, that's okay, and you should make the best decision you can, but do not let them back you into a corner saying that this can never change, because an IEP, what you have to remember is an IEP confers rights that are that are guaranteed by federal statutes. And neither the state of Ohio nor a local school district has the ability to do anything that interferes with your child's right to appropriate special education services. So if it needs to change, then it needs to change. And you just, my suggestion is just go through the IEP meeting process. The district, most sophisticated districts should understand this. And I've had some conversations with people about this. But I just don't want you to get too hung up on those kinds of format deadlines and thinking that you're locked in forever, because the district has to provide appropriate services that work for your kid, and that may change as time goes on. And then also just make sure the team takes your child's medical needs and vulnerabilities into account when they're making these decisions. Next slide, please. So along those lines, some other, kind of non-academic factors that you might want to discuss with your IEP team are kind of COVID specific difficulties that may arise for your child. So for instance, will your child struggle to wear a mask if the school district requires that? If you anticipate that's been a problem, so if you've had trouble getting your child to wear a mask, like to the store, or they're, they've been taking it off or whatever, and you just think that's going to be an issue, the sooner that you can raise that issue, the better, because, I don't really know what the answer to that might be, but there may be, physical barriers that they could erect. There may be a behavior plan, type thing that they may be able to implement, but you want to make the team aware of that as soon as possible, because I do anticipate that's going to be a difficulty for a lot of our kids. If your child maybe struggles with emotional difficulties that have been exacerbated by the pandemic, so if, I know for me, I have had a lot of my own anxiety about the pandemic, which has, impacted lots of facets of my life. So I think, we could probably expect kids to have those same kinds of fears. And it's just something that the team needs to plan for. Also, will there be structural alterations to the classroom that will impact your child? So, a lot of classrooms are being reconfigured to ensure, 6 feet of distance between students. And for a lot of our kids, structure and setup are very, very important. And you just need to make sure you're having those conversations beforehand to know, what you're getting into. Next slide, please. So changes to the IEP. So I want every parent listening to this to be very, very careful about major amendments to the IEP. Especially if a district is reducing or changing in a negative way the amount or nature of services received on the IEP. Because like I said before, the definition of FAPE has not changed. So if your child had reading difficulties that required them to have 60 minutes of reading comprehension instruction before the pandemic started, unless they have made, some really, really interesting gains for whatever reason, they still need that. And, there may be logistical difficulties in getting that delivered, but that does not need to come out of the IEP, because that still is saying, this is what the child needs. Now, if the IEP, if they want to add something to the IEP saying, we're going to, for the time being, deliver this instruction in a different way, then I would be more comfortable with that. If they do make those changes, you just want to make sure that you are documenting your disagreement with those changes in case you need to challenge them later. So ask the district in the IEP meeting if you are not able to come to a consensus to document your disagreement in the prior written notice. If they don't do that, then write a letter that kind of copied to your child's files stating your objections and why you're making those objections. And the reason that this is important is that it could negatively impact the amount of compensatory services you can get later. Next slide. So evaluations during COVID. We had some questions about this, so I wanted to cover it kind of quickly. The basics of evaluations have not changed, legally speaking. So to the extent possible, school districts should still be complying with the 60-day timeline for initial evaluations. So if that referral is made, then They are still on that 60-day hook. The only exception to when this might look different is if your child requires assessments that cannot be completed either remotely or at a safe distance. In which case ODE has stated that those assessments can be completed once the closure has ended. And also state guidance makes clear that ETR meetings can be conducted virtually or telephonically, just like an IEP meeting. Next slide. So the issue that that arises here is, of course, like what happens when a district is saying, your child requires this assessment and they're saying that they can't complete it. Well, I think you can go back to that next slide. If this is coming up in your cases, what I would suggest that you do is to have a conversation with those evaluators. And I think it's the next one, Amy. Sorry. I think that the couple more. Other way. There we go. So if the evaluators are saying that, then what I would encourage you to do is to have them think about alternative ways that your child can be assessed. So the normed assessments that we typically think about when we're talking about ETRs, like the WISC, the academic achievement assessments, those are only one tool out of many that can be used for an assessment. So if there's a school psychologist that feels that they won't get valid results out of one of those, then think about if there are other ways that they could get this information. So, they should be looking at your child as a whole, which can include, schoolwork that your child has done, teacher observations, data that you've collected. So this is particularly true since kids have been out for so long. Information that you have about their academic performance can be used. And then any sort of outside evaluations conducted by medical or other personnel. So if you've had an evaluation done of your child at a doctor's office or a children's hospital that gives medical or gives information that impacts the child's education, the team can use those. And then you can always say, like, let's see if the child meets eligibility based on what we have here. And then maybe down the road, if you still need to do those more normed, very structured assessments, then maybe you can do them at that point. But what I would want to do is to get, if it's clear that your child is eligible for services, kind of get the district out of, well, we just have to wait until we're able to do the WISC or whatever it is. And just, try to get them to think creatively about other ways they can get that information. Next slide. So reevaluations, kind of everything I said also applies to reevaluations. So the ones that have to happen every 3 years. One thing that I would want you to consider, particularly if your child has been in special education for a long time, one thing that you might want to consider is just having the team do a record review for now, just for the purposes of saying that they're still eligible. Unless you think that there has been some major change to their educational needs, then there might be concerns about taking that approach. But that is something that is available for them, and it might be, if nothing else, a stopgap measure to kind of get you to where they could do more typical evaluation procedures. Next slide. So compensatory education. Did a whole presentation about this. So if you have a lot of questions about this, I think Amy has saved our last talk about this. But if it's impossible for your child to receive FAPE during the closure, your remedy is to seek compensatory education once more typical instruction is possible. You need to be collecting a lot of data yourself about this, because your child, the amount of compensatory education is driven more by your child's needs than the amount of services that they actually missed. So it's going to be incumbent upon you to be able to go to the district with solid information about skills that your child has lost and the impact of them going without services. If you want more, like I said, if you want more information about how to collect that data, I would refer you back to the presentation we did in May. And something I wanted to include here is utilize experts if necessary. So if your child has been working with other professionals who can talk about how much compensatory education they may need or what it might look like, use them and bring them in and bring their expertise to the IEP team to help you make your case. Next slide. This is the key point about compensatory education that trips parents up more than almost anything else is compensatory ed or comp ed, as we call it kind of in the jargon of the field, is not awarded to students on a minute for minute basis. So if your child misses an hour of speech, that doesn't necessarily mean they're going to get an hour of speech as comp ed. The legal standard is the comp ed needs to put your child in the position he or she would have been in had the district provided appropriate services in the first place. Now, in many cases, it does end up being a one-for-one. I'm not saying it could never be a one-for-one, but I just don't want you to think that just because your child missed X amount of services that they are automatically going to get that much back. The case law is very clear about this, unfortunately, in the federal circuit we're in. So the reason I'm telling you this is you need to be prepared with more than just my child missed this amount of services. Definitely have that information because that is part of it, but it's going to be a larger discussion about the amount of regression, about the skills your child has lost, and then what it's going to take to bring them back. Maybe for instance, maybe you're which is great. Maybe you're an excellent parent when it comes to teaching, or an excellent teacher when you're teaching your child how to read or some other skill at home, and they actually haven't lost that much. Well, that's really great that you've done that, but it could mean that they don't need quite as much service to bring them back up to where they were. Next slide, please. This actually has changed since our last the last comp ed discussion. ODE has issued updated language about compensatory education. I don't really think it makes much of a substantive difference. It says basically what we already knew. It says the comp ed are services provided to the student because they were not able to provide the IEP services. School districts and parents can mutually agree to the compensatory education after the ordered school closure. Or you can utilize the more formal complaint mechanisms that we will discuss a little more later. Next slide. Oh, well, I guess we're talking about it now. So I did want to just briefly touch on the procedural safeguards. Some of you may know this information, but this is basically the steps that you can take as a parent to resolve conflicts with the school. So the IEP meeting is always going to be your first step. I would never, ever suggest a parent move to one of these other more formal remedies before trying to work out a solution at an IEP meeting. I would say between 85 and 90% of cases can be resolved at an IEP meeting. And it's going to save yourself a lot of time and potentially even a lot of money to try to resolve things at a low possible level, particularly now. The other kind of less formal options would be to have a facilitated IEP meeting or mediation. I kind of talk about these together because they look a lot alike. A facilitated IEP meeting is when someone from the Department of Education sends a trained facilitator to your meeting to kind of help work through the issues. So this is particularly useful when there is, for whatever reason, a lot of a not great working relationship between the parties. So if you have been going to IEP meetings and they just inevitably dissolve into screaming matches, this is a good option for you. Mediation is similar. There are usually fewer participants involved in mediations. It's usually just a parent and like a special ed director or someone who is able to commit the district's resources. And both of these processes are still happening virtually. So that it's actually really it looks a lot different because often they're happening over Zoom. So in my experience, it's not quite as useful as having someone physically there, but those processes still are available. You also have the option for superintendent review. That's not something that I really utilize very often because a superintendent is typically not someone who knows the child well and is someone who often does not have a significant background in special education. So I find that they typically, that's not usually the best way to go about getting something done, but some parents have success doing that. A state complaint, this ODE is still investigating state complaints, so that is the process by which you send the alleged violation to the department, and they kind of conduct an investigation to determine if the district has violated IDEA and will issue corrective action if they find the district in violation. The good thing about this process is that it can be done pretty easily without legal representation. They've made it a pretty parent-friendly process, but the downside to it is you don't maintain a lot of control over the procedure. So ODE basically does their own investigation, and then they will issue their letter of findings and their corrective action, but they're not going to ask you if it's okay with you, for instance, if this resolves your complaint. So that's why, you know, typically if I'm involved in a state complaint, I will advise parents to utilize mediation in conjunction with that. And ODE really likes it when you do that because they really like it whenever you can take decision making kind of off their plate. But the good thing about it is, like, it gives you some control over the process. So, you know, if you have one specific thing that is going to make this complaint better for you, often mediation is the way to go. And then, of course, there is the due process hearing. That is kind of the kind of last resort for major cases. These are still ongoing. I think last I heard, I have not been involved in one, but I think that they're still doing these hearings virtually. But this is basically, I mean, this is more or less like almost like a court proceeding. And we always tell parents that if they're going to go this route, then they really need to think strongly about hiring an attorney or contacting, you know, just having legal representation, because parents almost never win when they are proceeding without that, because it's a very legal and hyper technical process. And I just want you to remember the timelines that state complaints they have to be filed within 1 year of an alleged violation, and due process complaints have to be filed within 2 years. So just keep those in mind. Don't wait too long if you are sure that you are going to go one of those routes. And then this last note is, in order to, you can't just sue a school district in state or federal court for a violation of IDEA. There is what's called an exhaustion procedure. So you have to utilize the special education process, basically the due process hearing, before going to federal court on an IDEA violation. Now, there's a whole complicated area of law that I'm not going to get into that talks about what falls under exhaustion and what doesn't. That is a conversation for a different day, but I just want that to be on your radar. Next slide, please. So just some general advocacy tips. You've probably heard most of these before. Make sure you're keeping good documentation, making requests in writing, and just being very clear about what it is that you're asking for. I know I have a lot of parents who I talk to who are really angry about something, and rightfully so. And basically the first thing that I try to do is to get them to come up with a solid hard ask. So, you know, it's not enough to have an issue. You want to have some idea about what is going to make this better for you. Keep your focus on the present and what will resolve your problem. So if you've had issues with your school district before and there's hard feelings, I get it. This is not a fun process sometimes, but as much as you can let that go and just keep the focus on the child and what's going to resolve your complaint, the better. Get expert support. I talked about this. If your child sees people in the community, involve them in this process as much as they are willing to be involved, because they can give you some really good support. Next slide, please. Always frame requests in terms of your child's needs. So remember that special education is not a best interest of the child system, unfortunately. It is about a free, appropriate public education and getting your child a meaningful educational benefit. It is not concerned with what is in the best what is in your child's best interest, which I know is hard for all of us to hear. But the reason I want you to know that is if you or someone is submitting something on your behalf and is using this will be in my child's best interest, or my child will benefit from this, the district is going to look at that and be like, well, that's great, but we don't have to do what's in your child's best interest. They're not going to, hopefully they won't say it in those kinds of words, but they have to do what is necessary to provide FAPE, and it's important that you frame any requests in those terms. And just don't be afraid to reach out for help. So, there are lots of community resources out there. DRO is here. There are legal aid organizations around the state if you qualify for their services, and lots of supports that are represented even by people on this panel. Next slide. So I think I had one last slide there. So just this is just kind of a quick review. Key takeaways: get an IEP meeting scheduled as soon as possible to start working through these issues. Make sure the IEP retains the high expectations for your child and does not cut services because they're unavailable in their usual form. Monitor your child's progress closely. Stay informed about what's going on so that you can make the best decision possible. And above all, I don't need to tell you this, but keep you and your family safe. That is the most important thing. No one's going to be learning if they're sick. So I would say that that's priority number one for all of us. So just keep you and your family safe, and respect the school district's reasonable attempt to do that for their staff. If they are, they have legitimate concerns about their staff. A lot of times their staff are older and are particularly vulnerable to COVID. So, I'm not saying that you have to defer to everything, but just be respectful of those attempts. And I think that's the end of what I have to say. So look forward to questions at the end.
Hi, I'm Vicki Coleman, parent mentor from Northwest Local School District. And my co-presenter is Yvette Sarkar. Yvette.
Hi, I work for the Ohio Coalition for the Education of Children with Disabilities. We are a parent training and information center for the state of Ohio, servicing all 88 counties. I am a consultant and information specialist in the multicultural division, primarily servicing Spanish-speaking families. I'm honored to be here today.
And again, my name is Vicki Coleman. I'm parent mentor for Northwest Local School District. I am associated with OCECD as they oversee our parent mentor grant. I am in Hamilton County, and between Hamilton and Butler and Warren counties, there are exactly 10 parent mentors for well over 40 districts. Claremont County will be adding a parent mentor this school year. And we try to work together and to support one another. As parent mentor, it is my responsibility to focus on the child's education as a liaison between home and school. But it is my job to help you become capable as an advocate in what's called the two-way communication facet of advocating for your child. So that's what Yvette and I are here to talk about today. And we're going to repeat some of the things that John has said, but we're going to give special emphasis to them, okay? Next slide. All righty then. First question that I have to ask you is this. If I asked you to go put your hands on your child's IEP or 504 or ETR or behavior plan, progress report or report card, could you do that? Could you go directly to it and pick it up? If not, that's the first thing you need to do when this meeting closes. Because in order to initiate your meeting with the school, you need that information. That is your data on your child, not the school's. The school may have written it for you, but it's your data on your child. And so you're going to need that information before you sit down to email or write a letter to the school staff. You want to also have a goal in mind. Now, one of the things that Pete Wright tells us is that in order for our advocacy to be effective, we need to make sure that we have a long-term plan for our child's education and for our child's future. The truth of being the parent of a child with a disability is that many days we're overwhelmed. We only think from day to day. The best thing to do is to think ahead, plan ahead as much as you can when you get a quiet moment, and I know there's not too many, but when there are, take that time, think ahead. What do I really want from my child? Start making that future plan. Number two, you really need to know your child's disability well, inside and out. Because if you don't understand your child's disability, that allows the school to make all the decisions. You don't want that. You are a part of the IEP team. You help put input in, you help make decisions. Third thing, most important, before you sit down to write that email or letter, get your emotions under control. If you have a few extra dollars, go out and buy this book by Pete Wright, From Emotions to Advocacy, and it will give you good information about how to make your plan and work your plan and execute your plan for your child. You also want to document everything. If it wasn't written, it wasn't done. And if it wasn't written down, it did not happen. Nobody knows what was said. So that's the importance of documenting. When you have your goal in mind, that will help. You've already reviewed the IEP, the ETR, the 504 plan. Then you want to have an outline of topics to discuss in their order of importance. So you're triaging what's most urgent for you to what you can maybe walk away without, but you've gotten that first need met. And we've already said you're prepared by reviewing. Keep it simple. And if you have just too much to discuss, set some aside for another meeting. Pick your battle, plan your battle, go forward. Next slide.
Hi, so I want you to focus on your areas of concern. Think about going back to when the mandatory school closure occurred and what were some of the challenges that you experienced in the past? What are some of the challenges you're experiencing in the present? Camps closed through the summer. Are we looking at significant regression? We all know how hard it is to get our kids to reach some of these goals and how disappointing it is for them to have regression. Or was there an emerging skill that was just beginning that was lost as a result of this mandatory school closure? I want you to think about the future. What do you want the future to look like? What are your concerns for the future? John mentioned this a little bit, parent training and counseling. It is considered a related service. A lot of us went into this saying, we're not teachers. How do we do this? And how do we implement research and evidence-based practices in a remote setting? So, for example, I had one family that had ESY. They dropped off the materials for the student. The child is nonverbal. The parent had more than one child and also had a full-time job. But the school district decided to have weekly meetings with the parent with an interpreter, and that mother was able to prevent regression as a result of that support. This is something that could be documented in the related services. Did your child have difficulty with motivation or was off task? Did behavioral challenges increase or decrease based on either the lack of structure or the lack of demands? Socialization, is this something that has made your child become more alienated? as a result of having not been in school. School avoidance and fear. Some children are very fearful now to go back to school. How are we going to transition them? The mandatory school closures were very abrupt. Our children didn't get a chance to transition, and that was also very difficult for our kids and for us as well. So some of the things that I want to bring up that we need to think about is truancy hasn't changed. So how are we going to address if your child doesn't want to go to school? What is going to be considered an excused absence under these circumstances so that we don't get ourselves into situations where we're having truancy issues? Safety. If your school district did not have a pandemic plan before, do they have one now? If the school is going to be opening up, doing either classroom, a blended program, what safety policies do they have? How are they going to keep your child safe? What happens if somebody tests positive in this school for COVID? Are they going to close down? Will your child be in just one part of the school, or will they be going to other parts of the school? If one child has been exposed to it through a family, then are they going to be asking everyone to quarantine for 14 days? And what is going to be the backup plan if those things happen? So these are some questions that you may want to think hypothetically about when you have your meeting with your school. Next slide.
All righty then. You remember that we talked earlier about getting your IEP, ETR 504 together, progress reports and report card to get your data together or your pre-meeting worksheet. This is something that you can use on, it's the left on my screen, that you can use to plan what you're going to talk about as you decide what it is that you want. So you've already sent in your letter. You've asked the staff to get back to you within 5 days. You have your meeting set. Use this form to triage what is most important for you to talk about so that you know your date, your time, your place, and the purpose of your meeting. Then there's another idea there. What do you want? You have to know exactly what you want and what action you want the IEP team to take. Remember, you're a part of that team. They're not a team without you. And what data or facts do you have to support your request? As you're going into it, remember, don't blame, don't criticize. This pandemic caught everybody by surprise, whether they believe it or not. The reality is we're operating within it. So do not blame, do not criticize. Remember that you want to protect your relationship with the school. They are there to serve your child. And you also want to understand the school's position. I know it's not easy to put yourself in somebody else's shoes, but they have some perceptions. They might see a problem. They have certain interests as well as you do. What might they want? What are their fears? So in order to be a successful negotiator, you must consider those things. Also know who the members of your IEP team are. There must be you, at least one regular ed teacher, at least one intervention specialist or one of the related services provider, a school district representative, which could be either the special ed supervisor or the principal, someone who can interpret all that school speak and psych data for you, others who might have knowledge or expertise about your child, and if your child is of age and able to self-advocate or willing, your child can also be there. Don't forget that. Now, also helping you with that is the present levels checklist on the other side of the slide. You can find that online and download it to take with you also, so that this way you as a parent are acquainted with exactly where your child is, so that you can speak to the school's data and Yvette's going to talk some more about recording data at home so that you can take that in to show what your child's present level of functioning is as you prepare for the IEP meeting. Next slide, please. Now this, you can also go online to download if you choose. It is the IEP meeting worksheet, and you see there that it talks about what your request is, how the school responded, whether or not the issues that you brought up were resolved one by one, if there is going to be something started for your child, when it begins, and who is responsible. I see many times the parents just take for granted that it's done, and they don't check back in with the school, which is why what John said earlier about staying in constant contact is so very important. And you are there to support your child. So take advantage of these resources that you're being given to begin to plan your IEP meeting or 504 meeting. All right, next, Yvette.
Okay, so what are your learning options? So each school district is making their own decisions. So if your child is struggling with electronic, then maybe is it going to be you doing more hands-on? If it's classroom-based, maybe the teacher's going to be working on some of the areas that can't be worked on at home, or a blended program. What goals should be worked on at school and at home? How to implement research and evidence-based practices into your home environment. And one of the important things here is access. We always talk about access. If you don't have a computer, if you live in a rural area, you have difficulty with internet connection, these are things that need to be problem solved, because your child needs to be able to have access to their learning. And the other thing I want to point out here is, like John was saying, if you need to change things around at any time in the IEP, you know, if one setting isn't working or another setting isn't working, you know, how flexible are they going to be with, you know, creating a quick plan B if your child can't go to school for whatever reason. Next slide. So what kind of progress monitoring are they going to be utilizing? What metrics are we going to be using to measure our children's progress? Frequent communication, schools use the class dojos. How transparent are they going to be about incidents that happen at school? Maybe that's something that's important to you. Maybe talking once a week through email, text, or through their online systems that they have. This is a data sheet that I created when I was working with my child. It was just something in the absence of anyone giving me something, where you just have a skill, how much time you spent, and the level of proficiency, and notes. And that way you have something tangible that you can talk with your school about. The better thing would be, of course, would be to collaborate with your teachers and your intervention specialists. Learning tools and resources. Does your school district have an account with IXL, Moby Max, Khan Academy, Study Island? And if they do, can you get the user ID and password? This way your kids will have some access to Ohio's learning standards. Resources. I had a conversation with a parent. Something as simple as a pencil grip was an important tool to get their child to write. So what they're using at school can be used at home if you're in a blended environment. Updating your IEP and 504 to reflect the current educational programming. And just a side note that you can add a goal to a 504 plan. They're typically accommodation plans, but it is not out of the realm of possibility to put, you know, an IEP goal, not an IEP, I'm sorry, a goal for your 504 for reading or math or writing. And there's just one thing more eluding me. Yes, and graphic organizers. If you need graphic organizers to be able to help your child organize their thoughts, thought process. Next slide. Okay, this is my section as well. Okay, so you have different school options. I know that there was a point in my own life when I thought, is my child really in the best school placement? Is my child really getting the best education where they're at? And so I began to explore options. And I realized at that particular time, because of doing all the research, that my child was in the best placement that they could possibly be in. So, you know, the best way to have some control over the situation is to research what options you have in case one option doesn't work. So you have a plan B and have a plan C. Your traditional public school, charter school, and private school typically are brick and mortar building schools. You have an online public school system. They'll typically provide you with they'll provide you with the computer, laptops for the learning, but they won't typically provide internet service. It's just something to know. And your child is going to have good executive function skills, because with the online public learning, you have to be quite self-directed. You have to be ready to work right when they start and when they end. If you decide that you want to utilize the Autism and John Peterson scholarships, those can go up to $27,000. You'll need to know what your child's disability category is. You can find that right on their ETR. And the disability category is tied to the amount of funding you'll receive. Before you switch to Autism and John Peterson scholarship, if you haven't ever been on that scholarship, I would check with the state first to see if funding will be available, because that may change this year, funding availability. And just another point, with the Autism and John Peterson scholarship, you have to work with the providers that are under the umbrella of those scholarships, and you have to withdraw your child from public school. So the public school will still be responsible for their special education plans, but you have to do a formal withdrawal and provide documentation to the superintendent of the school. You can also do a homeschool program through those scholarships. Next slide, please.
Okay, we're going to talk about best practices now. Remember, if it wasn't written down, it wasn't said. And if it wasn't written down, it wasn't done. So you're going to want to get your own little phone book for your own little child and write down every time you talk to anybody about your child. And I would suggest even the doctor, make that your address book or your phone book for your child, who you talk to, when you talk to them, what they talked about with you. And if you have any concerns about what was said, so that you can go back and follow up, make sure that the issue or concern was addressed and resolved. You want to also keep a detailed record of what your child is working on, what their class schedule is. Keep that 504, that IEP handy. And as I said, organize your documents. It's simple enough to do. Just get yourself a notebook and put your documents in the notebook from oldest to newest. That way, when you're ready to go to your meeting, you can just grab it and go out the door. Reach out to your pediatrician, Ohio Family to Family. I know some people are still learning about that organization, the USAID, the LEND. Your local county board of DD can be so helpful. I discovered them quite by accident when my son was 8, and I'm so glad that I linked up with them. At that point in time, he was number 1,200 and something on what was called the waiting list, but he finally did get what's called a level 1 waiver, and you can learn all about this if you contact your county board of DD. But what you want to be is connected with them now, before they hit the age of transition. And Yvette is going to tell you a story about a transition activity that happened with her here shortly. You want to make sure that your child is connected with the County Board of DD before they are 14 years old. They may not get a lot of services then, but you definitely want to make sure that they're connected before they become adults. Also, your district may have a parent mentor. I understand there's less than 80 in the entire state with well over 1,000 school districts, but check in to see if you do have one. And if not, OCECD does have regional folk who can be your contact person. If you go to their website, ocecd.org, it gives you a state map and it tells you who might be your information specialist there, so that that person can be helpful to you. Also, there's milestones, autism resources, Autism Speaks, your Down Syndrome Association, your Williams support group. There are so many different disability support groups. Contact them as resources and keep them in that notebook. That way you'll be able to access that information anytime that you might need it.
Okay, so just to segue on that little part, which is I had a high school student that was really discouraged about the school closure, had a lower self-esteem, just really was frustrated. And he was referred to Opportunities for Ohioans with Disabilities, which I would encourage if you have any students in the age of transition to career, that they be connected with OOD. It's amazing because they were able to find him a little job this summer working from home, just answering phones, and then he got his little paycheck in the mail, and it was so motivating for him that he now is talking about going to college, and it has just been such an uplifting experience for him. And Opportunities for Ohioans with Disabilities will continue to support students post high school graduation. So it's just another really great resource for families.
Okay, in conclusion, what I would like to say is that schools are very important. They have wonderful teachers, but it's not all on them. You can do something too, Mom. You can do something too, Dad, to support those IEP goals. My son has social communication and social cognitive disorder, and he's a man of few words. So growing up and doing schoolwork, he would give me maybe 3-word sentences, sometimes only 1 word. So what I did was I would tell him, I need you to fill this cup. I need you to fill it with words. I need you to give me more. So that when we were modeling, I would model sentences for him. And if he would give them back to me, I'd give him a little reward and said, now this is what I need. So can you come up with some sentences on your own? And we'll count the words. And if he did, he got some more tokens. When he was bored, shall I say, uninterested or disinterested, we would take brain breaks and we would get fruit chews. But you only get a fruit chew if you do the work. And every time you do the work, you get a fruit chew. Yeah, I bribed him, so what? Okay, got it done, got it done. And I want you to know that my son, diagnosed with high functioning autism, was in general ed his entire career at Clark Montessori, graduated. Well, we tried college, it didn't work, but that's another story. But he was successful. And quite often, his teachers would tell me, well, he's doing better than some neurotypical kids. So what I'm saying to you is, Mom, Dad, the light shines at the end of the tunnel. The rainbow is real. It's gonna be okay. Keep working at it. Keep supporting your child. Don't let the school do it by themselves. You can help. And that's part of the training that you can ask for. If you don't know how to implement the IEP goals at home, ask for that training. They should teach you. They should give you the resources that you need to support them supporting your child. Yvette?
Yeah, and we really wanted to make this training so meaningful for all of you. We know that you all have different unique situations and circumstances, and some people right now are just really having a hard time with just economically. So we know that this is a tough time for all of us. We're all here to support you. If you have any questions and you just need, to problem solve, please email us. We're here for you. Just pick your battles, find time for yourself, and not every day is going to be the 100% day. And that's okay. I reached out personally over the summer with, some different private and public Facebook groups, and I was just so impressed about just perfect strangers trying to support, other strangers with their children. So there's resources out there for you. The only other point that I forgot to bring up that I wanted to is that in the Ohio's operating standards, thank you, on page 31 under related services, it is where it mentions about parent training and counseling, if you need to reference that to try to get that achieved in your IEP. And thank you very much. I was honored to be able to present today.
And thank you very much. Yes, I was honored to be presenting today. Thank you for thinking of me.
So I'm not sure if Amy's coming on, but I want to make sure we want to leave an opportunity for questions. And John, we got a couple in the box, and Vicki and Yvette also during your presentations. But if anybody has questions they'd like to add, can you please go ahead and type them in the chat box now? We'll start with the ones we have, but I will go back to those in the chat box as soon as we're finished with the ones we have. So John, during your presentation, someone had added in, and I think this is a really good and interesting question. My district is calling our meeting a virtual learning, I'm guessing that it's a VLO. I'm guessing the O might stand for opportunity, but it's called a VLO plan. And because we're going virtual, instead of an IEP meeting, would the VLO plan still be considered law abiding?
I would say probably not in the same way that an IEP is. So I think the Yvette and Vicki talked about it. So an IEP team has to have certain members. Those are listed in state and federal law. So there are required members to an IEP team. So the parent has to be there, the intervention specialist, general education teacher, if your child could potentially be in a general education setting, and a district representative, which is a person from the district who has the ability to commit district resources. An IEP meeting also, if any changes are made or anything happens in an IEP meeting, it should be documented in a prior written notice. And any changes to the programming and to the special education programming should be documented in the IEP meeting or in the IEP itself, I'm sorry. So I would want to have a little bit more information about what went on at that meeting. But if the district wasn't following all of those procedures and making sure those people were there, then I would not assume that anything that was decided is in the IEP. So I would be doubtful that that it would carry the same weight as if it was in the IEP.
Okay.
I have something to add to that. In the chat, I put the PowerPoint resources that Yvette and I worked on. Parents can open that up, but as I'm seeing the link, it just kind of all got put together. Parent Center Hub has a sample video agenda, so that if you're going to do your IEP by video, that's an agenda that you can look up. Yeah, all of the links got put together. I apologize for that. But if you open up the PowerPoint resources doc, you should be
I think she
Looks like,
froze.
looks like she froze. Okay, so and we will make sure all those are provided at the end of the meeting. We'll load everything up to our website, so all their links will be available there. I know somebody else said the email.
Can I just add one thing? I'm sorry.
Sure, go ahead.
Um, I don't want to, I don't want to come off like I think that that's about, I mean, I think it's great that districts are having those kinds of meetings, and I would encourage that. I mean, not everything has to be an IEP meeting. I just don't want you to assume that it's going to carry that same force. I don't know if I made that clear in my answer. So.
And I think you bring up a good point there, John, that I encourage families to ask those when they're having that, say now at what point do we need to move to have this reflect in the IEP, or do we right now? If we're at one semester and we're using the IEP as a guidance for that virtual learning plan, then it may not necessarily be necessary. But I think that's something that certainly bring up to your IEP or your team that's even on the virtual learning plan to say at what point do we need to, are we changing this enough away from that document that we need to somehow connect the two, wouldn't you think?
Yeah, and especially if anything is impacting specially designed instruction or accommodations or anything that's above and beyond what would be happening for a general education student.
Exactly. Okay, the next question was, would medical vulnerabilities make compensatory education more possible if online is not doable for some IEP goals?
I would say yes. If your child cannot be in the building for a disability-based reason, and they are missing services because of that, then yes, I would say that that is going to, assuming that those services can't be replicated in an online kind of curriculum. Like that would be the key issue: is are they receiving appropriate services through the online program? And so that would be the nature of the conversation when you got to the compensatory. But yes, that is something that could definitely entitle to a comp ed.
And I would encourage families to educate themselves on whether something is appropriate online or not. I think in both directions, in the sense that if school feels it is appropriate and you're uncomfortable with that, look into finding resources that can speak to that and help you feel more at ease with that presentation, in addition to assessments. Some assessments are going to be okay, or evaluations are going to be okay in an online setting, but some are not. And again, kind of discussing those with your IEP team and educating yourself as to where you can find that information, specifically as to whether or not that setting or that delivery model is appropriate.
And in many cases, right, the truth will out. I mean, if the district is providing not inappropriate services, that's going to be reflected in your child's progress. So,
absolutely. Last question that I found in the chat box was, what if your school is not providing a report card? Can this be enforced for kids on IEPs?
Well, I feel like I'm talking a lot. Does anybody else want to go first, or?
Vicki or?
Oh, not on mute.
I don't care to answer it, but
I mean, if it kind of goes along with progress monitoring, and it goes along with, that you want something tangible to show how your child is doing in their areas, in their subject areas. And I think that, they should be able to get a report card, that there's no reason not to get a report card. Or if you would like your child to get a grade versus a pass or fail. I mean, these are things you should talk about with your IEP team or your 504 team, but that is part of your progress monitoring question. How are we going to monitor progress? And what metrics and measurements are we using to determine that? And how are we going to determine grades so that we can get a report card?
I would agree with all of that. I will say, the operating standards for special education don't specifically address getting a report card for kids with disabilities, except to say that the district should be giving progress reports at least as often as other students are getting report cards. So it's primarily concerned with the actual progress report on the IEP goals, because that's the universe that the operating standards live in. But yeah, I would echo everything Yvette said. I mean, the key part of special education is giving a child access to the general curriculum, and it's impossible to tell if they're progressing or not unless you're getting that information. So that's the way that I would attack that issue.
So I'd like to ask a sub question, not John, as you say that, because my understanding, if I'm not correct, is the that it's access to the curriculum, and it's those core curriculum standards that we're trying to make sure that children in special education still get. So my IEP goals should not be the end all and the be all of what I'm, getting access to theoretically. So if I don't have a specific math goal, and because maybe I'm doing okay in math, but I still should have access to math, I guess that would be the place that I would talk about where a report card is really going to be important, because I need a reflection of what I'm doing, and the education should go beyond the IEP goals specifically, correct?
Yeah, and I mean, it's the only way to know that you don't, like, maybe you don't have a math goal, but maybe you need one, and that's the best way to tell.
Yeah, that would be concerning to me, not getting a report card. I think that would be a conversation I would encourage a family to go deeper with the team for sure. And maybe that's that place where that prior written notice opportunity of asking them to explain through that document that you've requested a report card. And if they're saying no to a report card, then asking for that prior written notice document as to explain why it is they feel a report card's not necessary.
Yeah, the key is for all these inquiries, you just want to make sure you're tying it to your child's individual needs, and going beyond, like, well, I usually get a report card and now I'm not, like, you want to go in with more than that.
Mm-hmm. Mm-hmm. I think that's everything. Oh, wait a minute. We've got one more in the chat box. Is the 504 plan a legal document, and does it carry the same strength and importance as an IEP?
Yeah.
Some teachers in my child's school have ignored his 504.
Yes, it is every bit as legally enforceable as an IEP. It's a different federal law, but it is also the law. So unfortunately, we see that a lot at 504 is kind of treated like almost secondarily to an IEP, but a school district is every bit as on the hook for 504. It's just that the actual procedural protections look different, but they're there.
John, is that something families can contact Disability Rights Ohio with?
Yes.
So that's sort of some of the resources that I would recommend as well. And then did we talk at all about, yes, and Yvette, please?
I just want to point this out because I think it's very important in regards to the 504 that, when a complaint gets done, it either goes to the Ohio Department of Education or, the Ohio Civil Rights Commission. And they only give you is at 6 months from the date of the incident. So if you have issues, you're on there's a very short window of time to file a complaint. So let's say, your 504 was violated and you're now 10 months from the point of violation. It's going to be very hard to file a complaint. It has to typically be within 6 months. Don, is that correct?
Yeah, except it's the U.S. Department of Education Office for Civil Rights. Yeah.
Thank you. Thank you.
And there that is one way that is the most common way to remedy. So if you complain to ODE about a 504 violation, they're not going to do anything because that's not their territory. That is the U.S. Department of Education enforces that, and you are correct. It is a 180-day time limit, and but there are also other options. But that is the most common. That's probably a presentation for a different day, but.
And then another question about for students who have more severe needs, whether they're medically complex and or behaviorally complex. Are there any unique or better strategies that families can take to assure that their child gets the necessary supports for their education at home?
So I would say that I've talked to parents that have had some challenges, and some parents have found amazing resources during this time, while others have been so lost and have had no support. And that is why I think it's so important to connect with your pediatrician's office. It's important to talk with your IEP team, because they know your child too. They've worked with your child and they can offer suggestions. The Board of ED may be able to provide some support to help you so that your child can have access to the learning tools that they need so that they can thrive in whatever environment they are working in.
Very good, thank you. We have about 4 minutes left.
It looks like we've cleared all the questions. So,
I put our contact, so instead of giving my specific contact information, the best thing for families to do is to contact our intake department, because, you know, there are lots of things that go into, you know, whether a case comes to me or someone else. So if they contact that line, someone will get back to them, and we will talk to them and see what their issue is.
Good.
And we also have a web intake on our website. I'll put that on there too.
Thank you. And Celia and I put together this COVID and education specific resource list, some of which we did talk about today. Well, we didn't, the speakers did. And, you know, we're getting new news almost every day, if not weekly. Stay tuned, keep in touch with any of us, your school team, other families who are going through the same concerns you are. Please keep reaching out. No question's a dumb question, you guys. We all, Yvette, myself, I'm sure Celia and Vicki, we have all learned from other parents, have we not?
absolutely.
So it's really, really critical to reach out, and you know, certainly if we don't have the answers, we will work hard to find you the people who do.
And Jennifer put in the chat box, she was asking about because she came late. This is being recorded. I know I sent you something that said it wasn't, but it is, and it will be posted along with all these. So if that's redundant, I apologize, but I want to make sure, since somebody actually questioned how they can access it later. That is how.
Very good. All
Well,
right, you guys. Thank you, everyone, for attending our session. Again, I'll send out a link via email. Please complete our evaluation. Please check out the website for the recording and other resource materials from today. Thank you all for being amazing speakers and so caring and resourceful people.
Amy, did the evaluation get put in the chat box?
It sure did.
All right. All right.
Thanks, everyone.
Thank you, everyone.
Thank you.
Bye.
Bye-bye.
Bye.